Hi there, my name is Farhan Chughtai and I'm a final year medical student here at Brighton and Sussex Medical School. Today I'm going to be walking you through a week in my life as a final year medical student. Before I do that, I'm going to be talking to you about what final year actually consists of and then talk you through a general week in my life as a final year medical student. So in final year, there are four main components. These components are your regional attachments, your final exams, your F0 and your elective. In your regional attachments, you'll have 5 3-week rotations in different specialties. These include medicine, surgery, elderly medicine, psychiatry, and emergency medicine. Within medicine, elderly medicine, and surgery, you can be placed in a number of different subspecialties as well. In these placements, you are expected to attend ward rounds and ward sessions, and also examine patients and help the ward run some tasks as well. This is partly in preparation for your foundation program, but it is also preparation for your final exams as well, as you want to be refining your information and making sure that you are well prepared for the knowledge test and the OSCE. Then you have your final exams. There are 3 main components to the final exams, and these happen between end of January to mid-February. The first component is the OSCE, or the Objective Structured Clinical Examination. This is where you go through a circuit of different stations, similar to an MMI interview, where you'll be interviewing patients and taking their history, perhaps taking some examinations, perhaps doing some counselling stations, or doing some initial assessment. You'll be assessed by examiners who are senior consultants that will determine whether you are safe and competent to progress to the next level. Your second assessment is the Prescribing Safety Assessment. This is a 2-hour exam where you are tested on your prescribing skills, detecting adverse events, counselling information, and also some drug calculations amongst other skills within prescribing. At BSMS, this is a graduating requirement, so you are required to pass this assessment before you can graduate. And the third component is the knowledge test. These are 2 papers, each consisting of 100 single best answer questions, testing your knowledge on medicine. Passing these 3 exams will allow you to pass finals and therefore graduate as a doctor. There are, however, 2 further components that you must complete before graduating, and these are F0 and the elective. We know that in the foundation program that there are F1 and F2. So the role of F0 is to attach yourself to an F1 to see what their day-to-day tasks are. The purpose of the F0 program is to ensure that you feel safe and competent to undertake practice as an F1 doctor in whichever hospital you end up in. You're required to do this for 2 months, and to show that you've completed this, you'll be signed off by the consultant on your ward. Then you have the exciting part, which is your elective. You will usually start planning for this in your 4th year, but this is when you can go to a different country and explore their healthcare system there. For example, I will be going to Iloilo City in the Philippines to do anesthetics and intensive care medicine. This will be a wonderful opportunity to see the differences in practice in Iloilo compared to the UK, and also to see where some of our Filipino nurses come from. If you successfully complete all of these, then you can graduate. So I'm going to take you through a general week in my life as a final year medical student at Brighton and Sussex Medical School in, for example, an acute medicine rotation. I started my regional attachments on acute medicine in Chichester, which is one of the regional centres that you can be allocated to for your final year. So my days would consist of going in at 8 AM and completing ward rounds. These would involve patients that have been accepted by the medical team to be reviewed by the medical consultants. The acute assessment unit is usually a short stay ward. Patients don't tend to stay there for longer than 48 hours unless they were absolutely necessary. We were also in charge of the same day emergency care, which is where GPs can refer their patients to the hospital to have any investigations undertaken, from blood tests to scans. Mornings would consist of going round ward rounds, adhering to consultant plans and getting jobs done. Jobs can range from blood tests to requesting imaging to speaking to other members of the medical team as well. And in the afternoon, you can either examine patients of your own or undertake some private study as well. Afterwards, the mess at the Chichester Hospital would invite students out to play badminton as well. There would be some times where I would also go to play badminton. On Tuesdays and Thursdays, the clinical education team would undertake sessions for us to revise for our final exams. On Tuesdays, they would focus on the knowledge test aspect of the UK MLA. And on Thursday, they would focus on the OSCE aspect of the UK MLA. They would cycle through different specialties each week, from cardiology to respiratory to hematology to surgery to psychiatry. These would take place on a Tuesday evening and a Thursday evening after placement. Wednesdays would largely be the same, but in the afternoon they would have Grand Round. Grand Round is where they would discuss interesting cases for the learning of every single healthcare professional in the medical team. And on Thursdays, there would also be something called Doctors in Mind. We all know medicine can be stressful, and so can the job. So Doctors in Mind was there to provide welfare support for doctors, medical students, physician associates, and PA students as well. We'll be able to go and there'll be some colouring things to do, there's some origami to do, there'll be snacks to go with lunch as well. It was actually a really, really nice time. And then on Friday, it would typically end with an early finish. Doctors know that it's probably been a long week for you with all the studying that you've been doing on the wards and at the sessions in the evening that they know that you've been attending as well. So they are sympathetic and let you go home early and have a little bit of an early Friday. In between then, with no specific pattern, I would also try to fit in some sort of physical activity at the gym and also some sort of outing with my friends to kind of de-stress from the environment as well. And that was a typical week in my life as a final year medical student here at Brighton and Sussex Medical School. I do think it's really important to prioritise your well-being. It can get very stressful during final season, so make sure you have time for yourself every single evening to make sure that your mental health is doing okay. And if you are struggling with your mental health at any point during exam season, at any point in your life, then it's always really important to reach out to someone that you trust. That concludes my video. Thank you very much for watching and I hope you found this helpful.